Kelly, could you introduce yourself and say where you're from?
Sure. Hi, my name is Kelly Pickens. I'm a family nurse practitioner. I'm in Madison, Wisconsin.
You see only patients with diagnoses of ADHD and autism, or do you see a range?
I see clients who are coming to me specifically for ADHD evaluations. They may already have other diagnoses, and many of them don't yet have a diagnosis of ADHD. Some do, but most don't. My perspective is that clients are coming to me because they are trying to find answers to the question of why they have experienced the world the way that they have, or why do certain things seem so much more difficult for them than they do for so many other people. Why are they suffering?
That's so interesting that I'm wondering how common it is for nurse practitioners to be doing that because it seems that people with those questions would normally go to a pediatrician for a child or to a psychiatrist. How do they find you?
I work specifically with adult. Many of my clients have gone to their primary care doctor, and they have gone to a psychiatrist, and they have gone to a neuropsychologist, and they are still not getting the answers, right? So they find me through Google, through Reddit.
Interesting.
Other therapists may be suspicious. And so I have some relationships with therapists locally. They find me because they're digging for answers.
How
And
common is it for a nurse practitioner to be in this position? Because it's the first I've heard of it.
there are no other nurse practitioner owned clinics in Wisconsin that are specifically doing what I am doing, nor have the credentials that I have. So I don't think it's very common. I guess that's the answer to that question.
Kelly, how long have you been doing it and what got you interested in this specifically?
I opened this practice in January of 2023, so not very long. I've been a family nurse practitioner for 22 years. What got me into this was in 2020, I was doing some continuing education credits and I did a course on adult ADHD. And I thought going into it that I knew what adult ADHD was or that I knew what ADHD was. I had been a family nurse practitioner for 17 years at that point. But as I was going through the course, my mind just was explosion after explosion, realizing A, I didn't know anything about ADHD, and B, I super duper had it. And so that was pretty life changing. And shortly thereafter, my daughter got diagnosed, and then my son got diagnosed, and COVID was happening. And so we were all falling apart. And I just really was digging for information to help them. I really wanted to arm myself with information for how I could parent them to help them be successful. And the more I learned, the more I wanted to learn. And I just couldn't stop learning. And the more I learned, the more passionate I became and realized, like, oh, this is a special interest that didn't just last for 6 months. And then I dumped that hobby. This is all I can think about.
Why do
That's
you
how
think it's so compelling, other than the fact that you have it and your children both have it?
what do I think is so compelling?
Yeah.
The statistic that sent me into a rage really was that ADHD reduces life expectancy by 12 to 20 years, and that children are
Right.
twice as likely to die
Yes.
in childhood.
Yes.
Still, I'm tearing up right now, like thinking about that. When I read that, I was furious because I was like, how don't I know that? I'm a family nurse practitioner. I take care of people from babyhood to the whole
But
spectrum.
hadn't you seen kids with ADHD or be as you in your previous job?
In my previous job, no. The 12 years prior to doing this, I was working with adults with disabilities. But prior to that, I had worked in urgent care and primary care and orthopedics. And so, sure, I've seen kids with ADHD. I had never diagnosed kids with ADHD,
And
but
had you been aware of symptoms in yourself, or is it just in retrospect? Did you feel like there was something going on with you when you were a kid, or?
things fell apart when I went to college. So it took me 6 years to complete my undergraduate degree in nursing. And that's when I was first diagnosed with depression or anxiety or adjustment disorder, actually. And I'd done therapy on and off my entire adult life from age 19 until 48 when I finally figured out what was going on. And therapy would help, but not really. And I just thought that I just wasn't a very good person.
In what way? How were you not a good person?
Not a good daughter. Don't remember to call and check in with my parents. I forget to send birthday cards, would forget to plan for Christmas. So, not a great mom. Terrible with my finances. Like, my financial career has been a roller coaster of life. Struggling to have the endurance to show up to work 5 days a week, 26 weeks out of the year, calling off often, showing up late, and just feeling guilty about that. And that there was just clearly something wrong with my character, that I didn't have work ethic. ADHD was not on my radar for any of that. I just thought, how could I possibly have ADHD? I have a master's degree, right? And then I learned, oh, you can compensate for challenges, and that's not the same thing as not having those challenges. And when you're very interested in what you are doing or studying or whatever, you're going to perform well, which has been for sure a pattern through my life.
It's wonderful to find your passion. I think that's what saves a lot of us from that statistic. So, what did it do for you to be diagnosed? How has your life changed since then?
Everything has changed. I never in my life thought that in my 50s I would leave employment after over 20 some years and start a business. So that is completely different.
What was it about the diagnosis that let you do that? Was it that it gave you confidence that you weren't a bad person or you could keep it under control? Or were you on medication? Were you being treated? Or
Yes. So all of that. Yes.
so you
um,
tried medication and medications worked for you?
yes, absolutely. Medication has been life changing for me. So right after my diagnosis, I Googled ADHD coaching and got an ADHD coach and worked with her for 6 months. And that was more effective than any therapy I'd ever done combined in my entire adult life prior to then. Right. Yes, helped correct the self compassion, the high self disparagement and low self compassion ratio helped shift that. That's still a work in progress because of internalized ableism, and then medication for sure. And the more I learned, and the more as I just accumulated these certifications, I realized that if I was going to do this as a career, like try to diagnose and manage ADHD in anyone, that I knew there was a way to do it that was right. And that if I tried to do that in a typical mental health clinic, I wouldn't be able to do that because I would have to bring them along with me.
Yeah.
And they don't have any training. They wouldn't have the level of education that I have. And I'm a family nurse practitioner, not a psychiatric mental health nurse practitioner. So many of the mental health clinics were like, no, you have to be a psych NP. I understand where they're coming from. And at the same time, there is a tremendous lack of access to psychiatric prescribers. Guess who has been doing that forever? Family practice, family physicians, primary care providers. I would still be expected to do all of the exact same things I am doing right now if I was working in a primary care practice. First of all, it gave me the freedom to really develop a program that is comprehensive, to develop an assessment that is integrative. So I have developed a program for assessment that is really like a collaborative exploration of identity. So we look beyond the DSM. We look for things like alexithymia, sensory processing disorder, interoception, things that can subtly nag at a person's quality of life when they're not recognized, and they're never recognized in typical assessment.
You're doing a psychiatric evaluation of
What I do is, I can't say that I do a neuropsychiatric evaluation. I'm not a neuropsychologist. I do a very comprehensive, holistic neurodivergence. So it's neurodivergent identity and comprehensive experience index. It's the NICE index. That's what my program is.
Did you create
Um,
that or did that exist?
no, it's what I've developed.
Oh, interesting. So how you test people?
We look at, if we do a zoom out and think about, okay, if your nervous system is developing differently, that is going to impact how you perceive and experience the world and then react to that. And so, if we think about the realms of experience in our lives, we can think of social, emotional, and sensory, cognition, right? Thinking, planning, decision making, being. How is all of that affecting your mood? Functional adaptability. How well are you actually keeping up with the day to days, to dos of life? Physical symptoms, because this isn't just our brains are not like some isolated organ that don't interact with the rest of our bodies. The genetics involved with ADHD and autism also result in a cascade of physical conditions that is a mile long. I look for all of those things as well. And then we look at the diagnosis specific things. And so it gives us this really comprehensive picture of what all's going on. Maybe we also even look at like attachment styles and the big five personality traits so that people can really get a deep understanding of themselves, because that's what they need. When you've been living your life late diagnosed, they have gotten to where they are because they have been masking, right? And compensating their whole lives. And so they don't know who's under there. So we're just trying to like peel back the layers of the onion and find out, okay, what's underneath so that they can integrate whatever inner masked self is in there with their external self and try to become more authentic as a person.
Do you find that most of your patients are women who've been diagnosed late in life?
Absolutely. Most people who find me are women because that has really actually been my focus. I have a special interest in women, partly because I relate to the experience. And I think also because it is much harder for women and girls to get diagnosed.
Sure.
And so I want to make sure that I hold space for women here. But I do see all genders. I'm not discriminating against any gender.
Do you find that many come to you with some depression and anxiety?
They always have been first diagnosed with depression or anxiety, most commonly, which makes sense because that is how they are high functioning. They have been using anxiety as a coping mechanism for having an interest driven nervous system their whole life.
Yeah.
Yeah.
How old are your kids?
My son is 20. He'll be 21 in September, and my daughter will be 18 in May.
Because in my case, and in many cases, it's the kids who are diagnosed first. So it's interesting that had you been having troubles with them that you couldn't really identify, and then getting diagnosed yourself helped you.
Yes, my daughter was diagnosed with sensory processing disorder at age 3 and had school avoidance from day one and inconsistent performance in school. We were convinced, oh, this is sensory seeking, this is sensory processing and integration. And we're just thinking about that and just never really thought outside of that, which is funny because their dad, we had been trying to get him an AD, back then we were thinking AD, inattentive ADHD diagnosis for a long time. And we couldn't because every provider would say, if you didn't have the diagnosis as a child, we can't give it to you as an adult.
Yes.
Yeah. But we just didn't know. There's so much we didn't know. But yeah, my daughter has had symptoms since day one. My son, we didn't quite catch his symptoms until middle school. Middle school is when things started to seem like he couldn't do the extracurriculars and do well in school. It had to be one or the other. If he would start band, then the band homework would be too much and too overwhelming, had to quit band. those sorts of things started to creep in. But again, thought, oh, maybe this is depression, because he was also very intellectually advanced. And we even had a pediatric psychiatrist literally said to our faces, you can't be ADHD, you're too smart.
Yeah. Oh my gosh. Can you imagine people still say that?
Yeah, this was just 4 years ago.
I'm wondering what led to your daughter's diagnosis, though. How did you figure out it was ADHD with her?
Once I figured out that what I was experiencing was ADHD, and so then I started doing research like, okay, how does this show up in girls? How is this different in girls? And I also started asking her more questions. So in the meantime, my daughter has also been diagnosed with autism. So she just got that diagnosis within the last 5 months.
Oh, wow.
So there's always been a difference, a social difference in terms of her like sharing information and communicating. So, like, whatever behaviors that we saw in her, if we would try to ask for explanation or, like, how was your day at school? What are you experiencing? Why don't you want to go to school?
She couldn't tell you. Yeah.
Exactly. So, we're just going blind. And so, I guess. I don't know. I just started to advocate for her more and just stopped taking no for an answer, I think, and found a clinician who was like, oh, okay, yes, this is ADHD. And then it was another 4 or 5 years before we were finally got, oh, yes, actually, this is autism. It's been autism and ADHD the whole time.
Well, I hope she's doing better now with that diagnosis.
So much better. She didn't even, it wasn't her pursuing it, but there was absolutely a change, a shift in her mental state, and like her level of quality of life, her being went up. And we don't really even talk about it.
Yeah.
But I think maybe just knowing, oh, I just experienced the world differently. There's
Kelly, do you sometimes look back on your own childhood and think, what would the difference have been in your life had you been diagnosed? Tell us about that. Oh,
Yes, without a doubt, a lot of things would be different. I also think about the thing that is really sad for kids who grow up with invisible disabilities is how they are often punished for the symptoms of their disability. And I certainly experienced that. Um,
so how did you, if you're okay to talk about it, how did you get punished and for what?
the most memorable is for being late to dinner.
Mm.
So I think it was about third grade, which is when I think you're learning how to tell time, right? And I really struggled. I would look at the clock and it didn't make any sense to me. And nobody really believed me. And so I'd be like, I just don't understand. It doesn't make sense. I can't tell how much time has passed. I was just expected to know, right? Be independent and know. And so I had been grounded 2 times in a row for being late for dinner. And then I went to my friend's house and I was told, like, you better be home on time or you are going to be grounded to your room for 2 weeks. So I arrived at my friend's house and I asked all of the adults there, because they were having like a family reunion or something. Can you please send me home when it's 4:45? Can somebody do that? And I had a sense that it was later than when I was supposed to be home suddenly, right? No sense of time until all of a sudden I was like, seems getting dark out. And I looked at the clock and I was like, ooh, that seems probably bad. And so I asked an adult, what time is it? And they told me, and I was supposed to be home at 5 and it was 6:30. Instantly was
Grounded.
just fell completely apart and had to walk home completely, just absolutely distraught, because I knew I was going to be grounded to my room for 2 weeks. And B, I knew that it wouldn't matter if I said, I don't know how to tell time, I don't understand, that they did not believe me, and that they really felt that I was doing this out of malice. I was ostracized. No, shame on you. How could you treat us this way?
So your parents never thought of having you diagnosed for anything, huh?
No.
Yeah. And I wonder if it had made a difference to them if had you been diagnosed.
That's a really good question. My dad passed away 2 years ago. Actually, he passed away the day before I decided to start this business. It was the next day that I was like, you know what? I think it was one of those things where you realize like time is, we
Yes.
don't have time. We
Right.
don't know when our time is up. So it's now, just do it, just go. And so I've never really had a good chance to talk to him about that, really. I've talked to my stepmother a little bit about it. Yeah, I don't really know what their perspective is of how things would be different, what they think it would be different. They don't know fully what my experience of growing up was with an invisible disability. I don't want to put that back in their face. Like they were doing the best they could. They didn't know.
The information they had. It's funny, it seems to have happened in the 80s where people really began to get more aware. Mm.
There's a lost generation,
Yeah.
and that started around 1987 to about 2002. There is a lost generation there
Huh.
because there was a massive disinformation campaign that was carried out
True.
against ADHD.
That is true. Yeah.
Yeah. Doctors didn't want to touch ADHD with a 10-foot pole. Schools weren't talking about it. Parents were terrified to even medicate their kids. Yeah, it was
And yet there were a lot of kids getting into trouble and getting into drugs and being shipped off to military school or whatever.
easily written off as character flaws
Yeah.
or moral deficit or skills deficit.
Big. Yeah,
Um,
that's still a big. Do you think that's still a big issue in kids being diagnosed today or?
I think that it is still misunderstood as a skills deficit.
Mm,
My kids' generation, Gen Z, and then the coming generations are more socially aware and more socially progressive and aware of mental health and so on than any other generation. So for them, I would hope that there isn't the shame. I don't know if that answers that question or not.
No, I think there probably is less shame. I think there is, but always when the things that I've found, the things that come with ADHD, like that lack of social skills and not remembering, I still feel it if I forget to send a birthday card or something like that. Like everybody else seems to manage better than me.
Yes. And that's for sure. I think that's part of the internalized ableism is this we keep bumping up against our symptoms
Yeah.
and thinking, I should be able to do this. I
Yeah.
should be able to do this
And
because
they aren't a magic bullet. You just have to maybe just train yourself or how do you help your clients like overcome that kind of thing?
I talk to my clients that they're not going to overcome ADHD.
Hmm. Mhm. Or
No,
get,
we have to normalize that ADHD symptoms are going to resurface over and over again.
Mhm.
Whatever systems are put into place to try to keep your bleep together, they don't turn into executive function. Whatever systems we put into place will require continuous effort and external support to be sustained.
It's more possible than it was with all the technology, because before I was thinking, hey, a kid could put an alarm on their phone. You wouldn't have to rely on the people at that party, right? You could say,
True.
I mean,
True.
my,
Yes, that's certainly possible, but there's no foolproof method.
yeah.
Like alarms could be snoozed, or you think you snoozed the alarm, but you actually turned it off. And so you thought you were giving yourself a 7 minute buffer, and you look and you're like, oh my God, that went off an hour ago.
That's true.
Right. So that's part of what I teach my clients is that we have to expect and normalize that ADHD symptoms don't go away.
Mhm.
They're not going to go away. They are going to be situational. So, whatever's happening in your life, whatever external supports are available to you, whatever the expectations are of you, if expectations exceed your abilities and you don't have the external supports to lift you up to do it, then the impact of your symptoms will be felt much more painfully.
I saw a brief interview with Trevor Noah where he says he has ADHD, where he was saying, if I don't get enough sleep, I know I'm always going to be overwhelmed. Does insurance pay for you?
I'm private pay practice.
Uh-huh.
And I really do that because I want to be able to have the time and have the freedom to do what I do here.
Yeah.
Right. Like insurance wants me to do things exactly this way and bill things exactly that way and code this exactly that way. And no, I'm not doing that.
Less paperwork for sure. But then do you find that you're not able to treat people from all different incomes, like your clients are fairly wealthy or?
It's mixed. I do take care credit. And so that is something that it's like a credit card, but it's very specific to medical, dental, and veterinary expenses. And so it has different approval policies, and it's either no interest or deferred. And so it is an opportunity for people to have a way to finance it over time. So I do want to be able to offer services to a wider range of folks for sure. But yeah, that's where it is right now.
This has been really interesting. And Cynthia, have I forgotten anything? Are there more questions you think I should ask?
I just wanted to ask Kelly, from all her knowledge now of herself and other females she's talked to, does she have any advice to give mothers of young girls? Because that's our target audience. So,
Hmm.
from your experience, what advice do you have for mothers of young girls?
Yeah, I've been thinking about that and thinking about your platform and your mission and your vision of to catch the girls by age 8.
Yeah.
And the problem is that boys' symptoms do show up early, but girls often don't even have symptoms until puberty.
Hmm.
And so it is harder to catch them
Even if
earlier.
you screen them.
It might not really take action until the hormonal changes are happening. And so the estrogen is doing this, and then so is the dopamine.
Yeah. But
I think that's part of the challenge of why we aren't recognizing girls younger, is because their symptoms are maybe there, but they're probably very subtle earlier. And they're not really showing up until middle school.
that's when you're
But
really swamped.
So,
Yeah,
yeah, I
right.
yeah,
have to jump in here because I guess my belief, Kelly, is that if we learn what to look for, we'll find them. And I agree, it's not a single one, but it's a complex. And if you're aware to watch for several symptoms like not turning in your homework, losing your
sure,
possessions, looking out the window, not having social relations, you put that picture together. And that's
absolutely.
where our checklist comes in is if you get a lot of checks, then it's more likely. So
Sure.
that we're teaching people it's not like with boys that if they're hyperactive and disruptive, oh, think ADHD. With a girl, you have to be thinking more
Right.
broadly. And what Dr. Orrin Mason says is don't be looking at them the first month of school because they always
They're
look good
great
when
then.
something's new and
Yeah,
novel. Look at
exactly.
them like 3 months in and say,
Yes.
I should relook at this child because I thought she was great, but now she's underperforming. And why
Yeah,
is that?
absolutely.
So I
Yeah.
still hang on to the fact that they can get diagnosed before age 8 if we're recognizing them.
And if their symptoms are there, they may not be. But if screening, like routine screening, just as there is for, we have routine screening for vision at certain developmental milestones and points, primary care doctors and pediatricians are screening for all kinds of things. We've been doing that since forever. And adding in how do we screen girls for ADHD at these ages? How do we screen boys? And just making that a matter of course, like this is the standard of care. That would change it without a doubt. It would. If we started doing that right away.
That's what the Inattentive ADHD Coalition wants, all children to be screened by
Agreed.
age 7.
Yep,
Um,
that's a I
and not
support.
just for ADHD, for almost all neurodivergent conditions. I,
Absolutely.
I've been told most of them you could tell by age 8.
I agree and support that wholeheartedly.
What would your advice be for mothers, though?
My advice for mothers, don't stop. You know your child better, right? We know in our guts what, if the doctor says, oh, don't worry about it, we know if that just doesn't feel right. Keep looking. Don't give up. Keep advocating for your child. When you have a child who is neurodivergent and you know in your heart how you need to parent them. And people around you may think, oh,
Yeah.
you know what you're doing.
One mother that I interviewed said that the whole world could be against your child. And so they need at least you on their side.
Yes. To quote Elaine Taylor Klaus and Diane Dempster, always think neurologic, not naughty. If your kid is misbehaving or being compliant with what you want them to do, never assume naughty first.
Right.
That's just should be for parents across the board. Never assume a child is being naughty for the sake of being naughty. Right. Always start with hungry, angry, lonely, tired, or neurologic.
Yeah, the phrase I heard was, if they're causing trouble, it might be because they're in trouble. Yeah.
That's a great one.
I think we're done. Thank you so much for your time.
Thank you. It was great to talk with you and nice meeting you both.
Thank you, Kelly. Glad you're out there doing this work.
You too.
Bye.
Bye now.
We believe all girls with ADHD should get a fair start in life by getting diagnosed by age 8. Visit us at www.FINDtheADHDgirls.org. Thank you.